Transgender employee at Center of Contract Controversy pledges to fight on. Oh no. It was an X. I thought it would close the... Okay. Okay. Jack Fonder trusted his doctor. He'd spent years under her care, and she understood his medical history. But that changed when he transitioned. It was one of the worst experiences I've ever had, he recalled. Fonder is a transgender man, a person whose identity is as a man, but he was assigned female sex at birth. While his doctor hadn't done it intentionally, she repeatedly used his dead name or birth name in conversation. The doctor also misgendered him by referring to him as a woman instead of a man during the visit, he said. The missteps grinded against Fonder. He realized quickly that he had to find a different care provider, one who wouldn't make him feel insignificant and ignored, someone he could trust again. Yeah, like I mentioned just a minute ago. It's really important for trans people to have doctors, healthcare providers that understand the trans experience, which is why I feel so fortunate to live here in Colorado, where it seems like that's the norm. Every single hospital I've gone to, and trust me, I've gone to a lot of hospitals. Every single hospital I've gone to here has been 100% completely accepting. Even like the job interviews and stuff I have, people have no problem here referring to me as my chosen name, even though it's not my legal name yet. Things have just been absolutely wonderful here in Colorado, and I can't imagine starting transition in a state like Kentucky or Tennessee or Alabama or Florida or, any of those other states. I feel very fortunate to be here. That experience isn't unique in the LGBTQ community. It's difficult for people in the community to find mental and physical healthcare providers who support them. If you don't have the words to express that, or if your mental health is already at a point where you're barely hanging on by a thread, those kinds of things can send you over the edge, Fonder said. It can make people not want to go back to the doctor at all. That's right. That's absolutely right. It can make you feel like the discrimination is institutional almost, and that you're not going to find a doctor who will be accepting of you, when that's not the case. Very often you will be able to find one. Sometimes it takes more effort than others, but that's why Fonder is the community health worker for the Transformation Project, a Sioux Falls-based transgender advocacy group. He helps members in the LGBTQ community connect with healthcare professionals and social services, so it's easier for them to get the care they need and avoid harmful health experiences. But earlier this month, Governor Kristi Noem abruptly terminated a contract from the State Department of Health that secured funding for Fonder's position. The Transformation Project plans to sue the state for alleged civil rights violations related to the cancellations. That's important. It's good that he's taken up that fight for other people, because very often we find in our community that people don't have the bandwidth to handle something like that. So what he's doing, what Fonder's doing, is very, very important. That's very important work. The nonprofit was awarded about $136,000 in federal funds to hire and train a community health worker to help connect members of the LGBTQ community to physical and mental health care. The funds dispensed by the state were earmarked by the U.S. Centers for Disease Control for the hiring of community health workers to serve rural areas and marginalized communities. The Transformation Project's executive director, Susan Williams, said in an open letter that the group was in compliance with the contract terms, though a letter from the State Department of Health announcing the terminated contract listed several alleged breaches of contract. Noem's spokesman, Ian Fury, told a conservative news outlet the reason for the reason the contract was canceled was because, quote, South Dakota does not support this organization's efforts and state government should not be participating in them. News of the terminated state contract ambushed Fonder. While it was upsetting for the LGBTQ community and for the Transformation Project, the unexpected announcement also threatened his livelihood and the livelihood of his spouse and children who rely on his employment. I'm just trying to live here, raise my family, and be a contributing member of society, Fonder said. To have these constant attacks, it does feel very personal when you're part of the community they want to attack. The role of the community health worker at the Transformation Project is not political. Fonder acts as a liaison to help connect LGBTQ people with resources and reestablish trust with healthcare providers so they can maintain their mental and physical health. He does not normally refer people for services, he emphasized. I'm not a doctor. I'm not a professional in the healthcare system whatsoever. I'm a person who can connect you to resources. I can't refer to someone for surgery for hormones. I can give you a list of doctors you can talk to for whatever you need, but not specifically for those things because we're not trained to do that. We just want people to be healthy, happy, and provide them the resources that they need. The Transformation Project has been an outspoken advocacy group for transgender youth in South Dakota as the demographic faces discrimination and hostility leading to depression, isolation, and suicidal thoughts, experts say. For example, 80% of LGBTQ youth reported that they've experienced discrimination for their sexual orientation or gender identity, according to the Transformation Project. 53% of LGBTQ youth in South Dakota have seriously considered suicide in the past year, and 19% report attempting suicide in the same time frame, which is higher than South Dakota youth overall. About 75% of LGBTQ youth also experience anxiety, and 58% report symptoms of depression. It's a big problem. And the legal battles that a lot of LGBTQ organizations face really contribute to that. While the 3-year-old organization has tried to help provide resources to LGBTQ people, the Transformation Project didn't have a dedicated position to handle the demand, said Susan Williams, executive director. Having a dedicated community health worker helps reach a larger number of people. Even before receiving his certification as a community health worker in mid-December, word had spread about Fonder's role, and he was able to connect about 10 people to physical and mental health resources. I know a lot of people who went through transition and didn't have services to help. It makes it harder and can be life-threatening, Fonder said, adding that the people he's helping are just barely getting through each day. Several of the people Fonder is connected with are college students, Williams said. They had some really challenging interactions with classmates because they are transgender and are dealing with some mental health challenges as a result of that, Williams said in an email. He connected them to mental health resources, arranged transportation for them since they don't have a car here, and will continue to work with them to make sure they're getting the support they need. Fonder added that he's known people who have died because they didn't have the right healthcare support and their situation was too much for them to handle on their own. He doesn't want that to happen again. I think a lot of this is, yes, we are serving the LGBTQ plus community, but if you take this away, we're just serving people, Fonder said. I'm doing the same work a community health worker at a hospital or helping with immigrants. We're focused on different communities, but we're still helping people. Fonder also connects community members with social services such as food banks, homeless shelters, and employment centers. He not only educates people in the LGBTQ community about services, but acts as a liaison and educator for organizations by offering information about the LGBTQ community. His role helps identify gaps in public services as well. There are places in the Sioux Falls community that aren't aware of what it means to be transgender or part of the LGBTQ plus community, and because of that, many people don't feel safe utilizing those services. Not everybody who needs to go to a homeless shelter is straight. Everybody needs access to the same kinds of services. The Transformation Project has announced its intention to retain Fonder in his role despite the loss of funding. It has set up an online fundraiser that asks the public to raise $105,000 to cover the funding shortfall that was created. We're still going to push forward and continue to do the work to push harder. Fonder said, "We're not going to give up or back down because our community needs us to be here and fighting for them." The organization is planning to open a community center in 2023, which will offer a space for the LGBTQ community to gather and host public health events. There's $75,000 raised already for the project, and a funding campaign will begin in early 2023. I think the community health worker program is going to lead to better things in the community, Fonder said, not just for programs in the LGBTQ plus community, but for everybody that lives here. This is really important. Let's check out the fundraiser. Okay. Not really close to the goal, but I'll copy this link and post it in the description of the video. Definitely go check out that link. And if you have anything to spare, please contribute, because this is a really good fundraiser for somebody that really needs it. This is going to help a lot of people in South Dakota. And people in South Dakota truly need it. There's not a lot of support out there. South Dakota's a relatively big state, but it's very much like Nevada, I think, in that a lot of the state is more or less empty, or farmland, stuff like that. So this is really important for the people of South Dakota. Please check out that fundraiser.